Tell us first, what happened to you those years ago?
Yeah, so I'd just been diagnosed with form of schizophrenia, and I gave up, essentially. I gave up. I just didn't think I'd get better. I just thought, yeah, there was no hope, really. Felt like a burden on people around me. And so I went to the bridge in London to take my life, and then I was stopped by this stranger that was just walking past, and just through his words of, I believe you'll get better, just simple words, it managed to kind of pull me back from the edge. And went on to, make a recovery, learn to manage my mental health, and then together with Rethink Mental Illness, we launched a campaign to find this stranger 6 years later, really to raise awareness of suicide and mental health, and we found him, amazingly.
It was remarkable, and actually you made a documentary about it, so let's see a quick clip.
Hiya. Hi, John.
How you doing?
Yeah, good.
Hello. How are you? I'm alright. Yeah? I'm alright.
Good.
His name was Neil, and that was obviously a very emotional meeting at the time.
Yeah, it was, yeah.
How did that make you feel about what you'd been through?
It was nice to kind of close the door on what had happened, actually. It was kind of the worst moment in my life, and kind of it changed round to kind of positive. It was really nice, yeah. I mean, it's still tough, go through ups and downs, but in a very different place now.
Yeah. And did you get any help at the time, I mean, in terms of services, mental health services?
To be honest, when I was 17, I first went to the GP and I said, things aren't right. And I was referred to CAMS, to the Child and Adolescent Mental Health Service. But the waiting list was so long, as it is today, that I just gave up waiting. And then when I was kind of really ill, when I was psychotic, I ended up going to A&E, and I begged to be admitted. I was really unwell. But they sent me home and just said, take some Valium, we haven't got any beds. And that was it. Yeah.
Well, that's part of the problem, isn't it, Brian? It's the lack of beds. It's the fact that perhaps mental health patients aren't seen in the same way as people who have physical problems. You were part of the task force saying to the government, please do something about it. Are you happy with what's been promised today?
Well, I think the task force is a wonderful moment, and I think the recommendations that are in it are quite rightly very broad and address a number of different things, not just what happens in mental health services. But I think actually the proof of the pudding will be in the eating. We need an action plan to deliver it, because the truth is, no matter how good the report is, and it is very good, there are many libraries which are groaning with best intentions. Actually, what we need to see is those recommendations delivered quickly, because there are certain things which I think would make a big difference to people like Jonny's life.
Like what?
Well, things like if you go to see, I mean, the interesting thing I think about Jonny, who's genuinely an inspiration in the field, is what was the thing that turned around his life? It was somebody listening to him. And that's true, yes, in public life, but actually it should be true when somebody goes to see their GP or their professional. And that assumption that somebody, just because somebody has a mental health problem, shouldn't be listened to has really got to go, I think.
And Jonny, your hopes, £1 billion promised, hopes that 1 million more people can be helped.
It's not enough. I don't think it's enough, personally. 16 million people, 1 in 4 in the UK, have a mental health issue. Just 1 million more, I don't think it's enough. And also sorry to criticise, but the time frame as well, by 2020, things are happening now. People are in crisis, services are being cut, staff being cut, beds being cut. And what we're going to do now, we need to focus on now, not just kind of a long-term plan. It needs to be a short-term plan as well, I think.
And how would you manage that short-term plan? What would you like to see, Jonny?
Well, I'd like to see kind of waiting lists cut down, standard waiting times put in place kind of immediately. Whatever needs to happen. If I know group therapy isn't ideal, but it's cheaper. Just some people across the country are waiting 3 years for therapy, which is just horrendous. So just having interventions such as group therapy, just in the meantime, just to keep people going, just anything really. I don't know.
Yes, OK. Brian Dale, thank you very much, both of you, and Jonny Benjamin, for coming in today.